Hello, everyone, and welcome to Family 2 Matters, Lessons Learned from Supporting Families in a Judgment-Free Zone, a session in our 25th Anniversary Lessons Learned series. My name is Pal Craigo, and I work at the National Abandoned Infants Assistance Resource Center, located at the University of California at Berkeley. Our mission here at AIA is to enhance the quality of social and health services delivered to children and families affected by substance use and HIV by providing quality training, information, and resources to the professionals who work directly with these families. This session will be presented by Tammira, the Program Director for the Family 2 Matters program at Light Health and Wellness Comprehensive Services located in Baltimore. For the last 2 years, Tammira has effectively implemented programming focused on providing comprehensive support services to families impacted by HIV/AIDS and substance abuse. Before we begin, I want to remind you that you may ask questions via the chat feature in the lower left portion of your screen. We will answer questions at the end of the webinar, but please feel free to chat them in at any point. And now I'd like to turn it over to our presenter. Thank you for being here with us today, Tammira.
Thank you for having me, Paul. I appreciate that, and thank you for that wonderful introduction. Good afternoon to everyone on the East Coast. Good morning to everyone on the West Coast. I'm excited to be able to share this information with you all. For the last 4 years, we have definitely, took on a Judgment-Free Zone program, so it is my honor to really show you all or give you all information on how we did that. Just to give you a little bit more about Light Health and Wellness Family 2 Matters program, the program specifically provided services to families that are impacted or that were caring for a child that's impacted by HIV, AIDS, or substance abuse. Through that program, we provided services as far as group services, respite activities, different trauma-informed therapies, home visits, and we'll talk a little bit more about the array of services that we offered. So I just want to go ahead and get into the presentation. So I want to ask you all a question. You don't have to answer this out loud or through the chat, but, when you look at this number, what does this number mean to you? What does it mean? And hopefully you were able to kind of relate. Most of you all said, well, it's my Social Security number. Well, to a lot of our clients, they felt that they were just a number. They came into our organization and quickly thought that we will only identify them as a number. Social Security numbers is literally the way that we more than likely navigate a lot of our life through. Everything needs our Social Security number, and we're just a number. And just thinking about that, we didn't want our clients to feel like a number. We wanted them to feel like people, and we wanted them to understand that, yes, you have this number that's associated with you, but you're not just a number. And that's why we took on this approach of, building a judgment-free zone. I chose this picture, and this presentation will be very visual because, honestly, I want you all to really be able to identify with the type of clients that we actually work with. And this picture right here is literally a picture of kids playing outside. And if you just take a look at it, it doesn't feel that it's the most safe environment or the quality environment for them to really be playing outside. And this is the reality for a lot of our clients and our children that are in our program. This is their reality. And I'm sure that a lot of you all have clients that you can relate to this as well. When I decided to place this picture on this presentation, this really depicts a lot of issues that our clients will come in the door with. So, yeah, they may, a lot of our clients had issues with substance abuse or HIV and AIDS, but all of those issues also included, different issues environmentally. They didn't have enough finances. They didn't know what to do, and this was their reality when they got home. They would be out there, things would be outside. And, when you're working in a program like this, you have to really understand, well, how do you make someone feel that they are valued when this is their reality? And how do you do that without them thinking that you're judging them because they weren't able to effectively pay for their rent or pay their gas and electric and things like that? So, yes, we have to offer these other services, but how do we ensure that our clients feel that they are valued? So many of our clients really couldn't remember a time when someone actually encouraged them or to do more. And they were scared to, share their stories and share what it is that was going on with them. They would come to our group sessions, and some would sit there quietly. They wouldn't say anything. So I knew that we had to figure out a way to connect with these people. We had to ensure that they are able to talk to us. And how do we really implement that empowerment? They were scared to really share their goals because their goals didn't seem realistic to them. Have you ever felt that you dream so big that there's no way that those dreams can actually come true? Well, just think about the small goals that some of our clients had, and they felt like they could not achieve those goals because of their reality. So our approach to that was really helping them to identify their biggest obstacles. I love to kind of back my way into helping a person and, using the approach of, well, what is really holding you back? Some of our clients will be able to tell us what those obstacles were, and some of them didn't realize that their obstacles were actually obstacles. So we had them create SMART goals. SMART stands for specific, measurable, attainable, realistic, and timely goals. And we sat there and worked with them. And they didn't realize that simple things that we probably take for granted every single day were simply small goals that they wanted to achieve. And we helped them set those goals. And we helped them make sure that they're able to see those goals everywhere that they go by creating things like vision boards and helping them come and bring their goals and speak about their goals to the group. And they felt at home when they were able to do that. They felt that they were valued. And through that, we were able to offer them accountability. And what do I mean by accountability? No, we're not growling at them constantly about you haven't achieved this goal, but we ensured that in a group setting that they held each other accountable. Because the reality of it is a lot of them did not have people that they could connect themselves to that was positive, that would actually push them to do more. Remember, some of them couldn't even remember a time when someone actually empowered or encouraged them to do better. So we offered them more accountability, just not from the staff, but also from each other, so peer accountability. And we encouraged them to be very transparent, but we were also transparent with them as well. One of the things that we ensured is that we shared our story. Everyone has a story, and it's important that everyone, be transparent so that they can feel that they're not in this by themselves. I absolutely positively love sharing my story and really getting a reaction from them that this was my reality before also. And then we had other people come in and share their stories that they felt were good role models, and they needed to hear their obstacles and their journey and those things like that. We really focus our workshops on specific client needs and not our assumptions. And the way that we did this, we simply asked them, what do you need? What would help you to achieve these goals? What would help you to be more accountable to yourself? and we design those workshops to specifically focus on those needs. And then our wonderful team conducts home visits to assess their stress levels. So based off of all of the things that we are sharing with them, we ensure that, we actually assess their stress levels through some tools that we use. Many of you may be able to identify what this picture represents. And if we have anyone that's from Baltimore or closely watch what happened in Baltimore when the unrest took, this is a picture directly from that. And many people would say, well, why are these people, they're crazy, what are they doing? And they would, simply really just judge them from this picture. And yes, they're doing, things that shouldn't be done, but what this picture really depicts is that our families don't know how to effectively communicate their feelings. They don't know how to take a situation that they're in and really kind of identify how to get out of that situation. And this is the way that they react. And it's an unfortunate situation, but they don't feel safe. They don't feel that their voice matters. They don't feel like that they can talk to anyone. And this is the things that happen when they feel that way. The clients came into our program with safety issues. They felt like they had nowhere to go, and they really needed a place that they could come talk and get resources without being judged. The picture that I just showed you, a lot of people quickly judged those individuals. They called them, maniacs and things like that. But really, what is their story? Why are they doing this? There's a why to this. It's not just because, they think that it's a cool thing to do, but these people are hurt. These clients are hurt, and they don't feel safe, and they don't feel that their voice is actually valued. So what was our approach? It was very simple. We had an open door policy. You didn't need any appointments to come in. Anytime you needed those services, anytime you needed anything, whether it was to talk or you needed help to find how to pay your BG&E bill or your electric bill, we had an open door policy. We ensured that someone was always there to make sure that their safety and everything was valued when they walked in that door. And that approach seemed to work really well. We loved seeing our clients come in, and they didn't even abuse the system, which was, something that a lot of people may think that people would do would be to abuse our open door policy. And they didn't do that. And they didn't do that because we ensured that they got exactly what it is that they needed, and we ensured that we didn't do it for them, but we assisted them into doing it for themselves. This visual is an indication that they want a voice. People wanted to feel that they had a voice in what was going on in their community, what was going on in their household. A lot of them never had an opportunity to voice what's going on and how to really leverage their voice to make an impactful impact on their community. So a lot of our families didn't believe that they could really advocate for themselves. We always, let them know that they are leaders. They didn't realize that they were leaders in their home, and they could really utilize those traits to be leaders in their community and work in other places. So what our approach was that we encouraged our clients to be part of community events. We ensured that they knew what was going on in their communities. And although we service families throughout the Baltimore City metropolitan area, we ensured that they were very well versed in what was going on in their community. We didn't make decisions by ourselves as a program. but we involved our clients in the decision-making process of the program. And we also allowed our clients to lead workshops. Why not? Each of our clients, they offered some type of expertise and they did not know it, whether it was leading a sewing class or actually just leading an empowerment session in a group session. They were able to do that. They were able to hold each other accountable, and they were able to listen to each other. We love that peer support that we were able to implement with them. And our clients came in simply saying, I need help. A lot of them didn't know what they needed help with. So we had to work through that. We had to, help them understand what it is that they need. And we did that by, yes, I can. We did that, again, by helping them identify those obstacles and setting those goals and looking at what is it that you want to accomplish, or where is your family now, or where do you want to get your family. And one of my favorite things, and I think I talk about this a lot, is the peer support that we implemented. So we said, how can I help others? A lot of the clients said, how can I help others when they couldn't help themselves? And we took an approach of helping them identify their strengths and expertise. And then we offered those trauma-informed group therapies to embrace those strengths and expertise so that they would be able to not only help themselves, but help others that are coming in the program or are currently in the program, and they've built these relationships with to help them. And we assign accountability partners. So one of the reasons why the open door policy worked was because they didn't just always have to come to us. They could also come to their peer accountability partner. I found this quote, and, I loved it because at our retreat, so each year we would host a yearly retreat, and this is where a lot of the peer support came in, and a lot of times that we leveraged those strengths and weaknesses, or those strengths and expertise of our clients. We would have them conduct their own seminars for other clients and other community organizations that will come in. So together we grow, together we cry, but together we know we have what it takes, so we must always try. And that's something that we always embedded in them, is that we know that the road isn't going to be easy, and we know that there are going to be a lot of tears throughout the way. But if you know that you can try and keep trying, you'll eventually get there, and you'll be able to really help yourself and help others and help your community. This is an actual picture from a group presentation that we did at our retreat that each and every year our clients love to participate in. They were able to get, like I said, their expertise from us, from each other, but also outside resources that we will bring in based off of the client's needs. And I think that's one of the biggest things that I want you all to understand, is that we base our services off of the client needs rather than assuming what the client needs. Of course we had to, allow them to know, well, this is what you need, but we, really assess their needs and said, these are the services that we're going to bring in. So the action steps that we took to implement a judgment-free zone is we implemented support groups that clients actually need. We embraced the client talents and gifts through support groups. We had client-led support groups, and we implemented talking groups with the clients. So there were a lot of times that we would just have a group and let it be a talking group rather than a specific focus on that group. And a lot of times we discovered a lot of things that were going on within the clients, but other clients were also having those type of issues as well, which allowed us to, again, create those groups that were going to meet the client's needs together. And one of the things that's not on here is that we had many one-on-one sessions with the clients. And that would be, focusing, I guess, in a lack of better terms, because I really don't like using this term, but case management, and taking that client and looking at year after year, where are you and what it is that you are, what are you doing, and how can we, again, help you individually and then help your family. We also took our approach, but we weren't just focusing on the kids' needs, but focusing on the adults, because we need them to understand in order for them to be healthy for their children, they need to be healthy within themselves. So those are some other things that we did outside of these 4 things, is focusing on the adult needs as well as the kids' needs, and then putting that together. We did a lot of family activities, and those family activities really helped the clients identify that some of their issues are directly impacting their children, and some of the issues that the children had realized that they were directly impacting the adult. And they were able to really work through things based off of their interaction together as a family. So our evaluation techniques that we use in-home assessments, we use the stress index, we did trauma-informed feedback forms, and we did an audit of the group participation. And, looking at those things helped us identify what was really working, what did we need more of, and how can we kind of adjust our plan to make sure that the client's stress level remains low and that they also have a better quality life. Now, because this was a new approach for us, we did have obstacles, and, they were good obstacles. I love having obstacles as I'm implementing new things, but because it really teaches you how to readjust and reevaluate your plan. So because this was a new approach, clearly that was an obstacle, is that we didn't have anything to really base, how it was done before. So it was a new approach, and our clients had to get used to the new approach. And life happens. A lot of times, things in the client life happens, and we have to understand that things are going to happen throughout their life, and they're not going to have as much participation. And then the lack of community resources. There were a lack of resources that our clients directly needed, and we had to make those resources available and create those resources for the client. So those were 4 of the main obstacles that we had as we went throughout this approach. But they were good obstacles that I enjoyed. So what were the results of all of this? I am very excited, and I'm very proud of my clients and the way that they kind of maneuvered through their issues and the things that they were going through gracefully. So the clients really began to share their story with others inside and outside the organization. So we created advocates out of our clients. Now not only are they able to help inside of the organization, but they've been able to also help outside of the organization. And they pushed themselves to achieve goals. Some of those goals weren't easy, and they really pushed themselves more than we pushed them eventually. Now they are, again, able to advocate for themselves and for others. There were a lot of times that, many of the children had issues with school, and they didn't feel like that they could go to the school and effectively advocate for their child, and now they are doing this. And it brought new opportunities into the program for others. And we were able to, build partnerships and things that really helped other clients throughout the other programs that we had. And the clients began to be heard. That's really a lot of what it was, is that they wanted to be heard. They wanted people to hear what it is that they have to say and what it is that they need. They were able to start holding each other accountable. I love when, I would actually have them make the phone calls of who's attending groups. And when someone would say, well, they aren't attending, the peer will hold them accountable for not attending. Why aren't you attending? How can I help you? Because we want you to attend. We want our groups to be successful. And then they became a resource for one another. They would get into groups, or they would call each other and say, hey, I have this resource that I think that would be good for you. I know somewhere where you can get this assistance. And they kind of pushed me out the way sometimes, but I think it was very pleasing to see that they were starting to find resources for themselves and were able to share those resources with their peers. And then the decrease in their stress levels. We saw their stress levels decrease throughout the program based off of the services that they were provided, which was always an awesome thing to do. And then they began to feel safe and utilize family matter and light as a safe haven. So they knew that once they came into the building, they were safe, and all of the information that they shared was safe. They also felt that their children were safe in their environment, and some of them enrolled their children in our child care center. So these were the results, and I am pleased to announce the results of this approach. And I feel like that the clients, and they will tell you themselves that they love the approach that we took on making sure that this was a judgment-free zone for them. I feel like I went through this very quickly, but I'm going to go ahead and open the floor up to any questions that you all may have. I know someone asked me to repeat what the SMART goals mean, and SMART goals is literally, it means specific, measurable, attainable, realistic, and timely. And what we would do with that is we would have them write that down as an acronym, and we would identify what is that specific goal. How can we measure this goal? Is this goal, what steps do you need to attain this goal? Looking at those three things, is this goal realistic, and what time will you achieve this goal? Setting the time on a goal is very important because you can set a goal and it'll be floating out here. So we made sure that we, really told them that putting the time to the goal is important. You're welcome.
Great. Thank you, Tammira. This presentation was great. So as Tammira said, if you have any questions, you can start chatting them in. And I have a few questions over here. So one of them is, are there specific policies or guidelines or rules in the program, either that staff follow or that clients follow, that kind of help create this environment of a judgment-free zone?
Absolutely. So, the policy and, for the clients was when we're getting in a group setting, everything that is said inside of our, facility stays inside of our facility. And to completely be honest with you, we never had a problem of anyone sharing information about somebody else. I think that their biggest concern was being together and being a good support, because we identified that, again, a lot of these people did not have the support system that they needed. So when they got into these groups or, working together, they realized that I've been through this. In some way, shape, or form, I've been through this, and this is not, I never wanted anyone to judge me, so I'm not going to judge this person. And, literally just setting that tone of whatever goes on in this facility stays in this facility or stays in this group literally worked. And it was too surprised by me that it actually worked, that it did. I was like, wow, no one, we didn't have any of those issues. And, of course, with our staff, we definitely have confidentiality forms. But I think that's one of the things that really helped the clients feel safe too, is that they, knew about the confidentiality form that we had.
Great. So another question that somebody asks is, can you give a bit more information as to what the stress index is and how it's administered?
So I can give you as much information as I can, because our actual evaluator did the stress index for our clients. But what it was is it's a series of questions that they ask, and based off of the questions that are asked, they're assessed at a number, and it just clearly identified where their stress levels were. We did this in the home. So these things were identified in the home because that's where the client is most comfortable, in their environment. So they will also see how the child is interacts with the parent and things like that. If you email me, I can ensure that you get more information about the stress index. But that's something that our evaluator definitely kind of did, her team went in and did the evaluation as far as the stress index. I mean, but it was administrated in the home with the client and the child being there.
Great. And then somebody commented that they thoroughly enjoyed the presentation from the visuals to
Thank
the
you. Thank
nice.
you.
And then another question is, what if you learn about child safety issues that should be reported to CPS?
Can you get a little more detail? If we felt that the child had safety issues, should they be? We definitely that's just we are mandated to do that. If the child is has any safety issues, we have to report them to CPS. We did not have any clients to actually, be in this situation. Most of the clients, if not all of the clients, were caring for a child that has been in that situation rather than that child being directly in that situation at the time in the program. But our staff, including myself, if we've ever, learned that the child was in any type of safety issues, we had to report that to CPS.
Great. Yeah, I wonder if that was connected to the, you talked earlier about confidentiality and keeping that safe, but it sounds like this is obviously an exception to that situation.
Yeah, absolutely.
Great. So I have another question, which is, so how did it impact the model that you have, the judgment-free zone model, if clients are, for example, going to other agencies or getting other services, and in those other agencies there isn't this same kind of culture, did that impact when they came back to your services, or was there any kind of issues with that, like switching between the different cultures of the agencies?
No, because the services that they will receive from other agencies wouldn't be the same support services that we are offering. So their services will be more of if they need financial assistance, if they are looking for like psychiatric rehabilitation services and things like that. Now, we were very strategic about who we would recommend our clients to, and ensuring that they do have an environment where they're going to not feel judged, and they're going to get the same type of feeling from that they get when they're at light. But we didn't have any issues like that because I think that they felt like they knew where to come when they needed that support service, and where they're going to get that from. They don't want to leave. They never want to leave, but that's a good thing because they know that we've made this this environment very safe for them, and we've made it pretty much a home for them to come to. They know that when they come in, they're going to be loved, and they're going to get the empowerment. Now, don't get it wrong. I'm very hard on them because again, they haven't had this push from people, so they know that I'm going to push them, and again, I'm not going to do it for them, but I'm going to help guide them to do the things that they need to do. But we didn't have any issues as far as them feeling that they weren't getting the same treatment or different treatment. They knew exactly what they were going to other agencies for and the services that they were going for. So we didn't have to worry about them coming back, I guess, unhappy.
Mm-hmm. Wonderful. And then one last question I have for you, Tammira, is so you mentioned some action steps for building this model. And I noticed it was like, for example, creating the groups and things like that. And I wonder, what is, if somebody is just considering wanting to build a similar model to the Judgment-Free Zone model, what is, the first thing they should be trying to do to, even before getting to the groups maybe? Are there specific things they should be researching or learning about?
Well, one of the things they need to identify is knowing who their clients are. We knew that we were dealing with clients that had trust issues. So before we could even provide those services, we had to overcome how do we get these clients to trust us? And that's always a challenge. And I don't think it's one specific way to really do that. It all really depends on the clients that you have and why they have those trust issues. A lot of our clients had trust issues based off of other organizations promising them services that they never received or promising them outcomes that they knew that they weren't going to give. And I think because the light has been around for a very long time and they were able to build that rapport from our existing clients, they were able to tell new clients to say, hey, these are people that you trust because they haven't broken a promise to us since inception. So it's just knowing, who your clients are and how you're going to really break down those barriers that they're having as far as trust and, other things like that.
Great. Thank you so much, Tammira. So that's all for us in terms of questions. So do you have any last comments, or I think otherwise we're ready to wrap up?
Oh, no, if no one has any other questions, I am fine. I hope that, everyone really consider taking this approach and, really looking at how you can create that judgment-free zone for your clients.
Great. Well, Tammira, thank you so much for speaking with us today. Your presentation was great. And I would also like to thank everyone who attended the session. We greatly appreciate your feedback, so please take a moment to complete the evaluation survey you'll find in the follow-up email for this session. And you will also find these slides attached to the follow-up email. And finally, please remember that we have a few lessons learned sessions left today, and you can register for each one individually on our site, and the site will pop up once you close this window. So thank you again, everyone. Have a wonderful day.